Hey guys, Stan Efferding here, founder of The Vertical Diet. We provide a simple, sensible, and sustainable solution to help you reach your health and fitness goals. First, get started with our easy-to-follow Vertical Diet ebook, which includes a quick start guide and sample menus to customize a diet plan that fits your goals. Second, use the My Vertical Tracker app to help you monitor and maintain your progress. And third, for our busy clients who are always on the go, let us do the cooking for you. Our Vertical Diet Meal Prep Company offers free shipping for your favorite meals delivered to your door in the US and Canada. So head on over to stanefferding.com and get started today. Welcome back, everybody. Stan Efferding here, founder of The Vertical Diet with Damon McCune, registered dietitian, PhD exercise phys, a whole bunch of other alphabetical names that I've since forgotten. He's actually almost finished with his MBA as well. He just got bored in the middle of his PhD thesis, decided to start getting his MBA at UNLV, which is great. Well, we're back here again with another episode of the Vertical Podcast. Very special guest, somebody I've been following for a couple of years now, watching every podcast she's done, read all of her stuff, following her on Instagram. An incredible resource. Damon, I'll let you do the introductions.
Yeah, so today we have a guest that really doesn't need much introduction. I don't think. Just very well known in the industry. She was actually just on The Doctors. Great segment, by the way. Dr. Gabrielle Lyon. So I'll let you go ahead and give a little bit of your background and kind of let the audience know what your specialty is and kind of what you do and kind of how you got to where you are now.
All right. Well, let's just say that I've been in school way too long. So about 17, about 17 years later, I can't even believe it. So I am a physician, and I have a really unique path. I did my undergraduate training under Dr. Donald Damon in vitamin mineral metabolism at the University of Illinois. After that, I went to school, and then I did a residency 2 years in psychiatry. Brutal. Switched out of that immediately. Then I did family medicine for 3 years, and then I did a nutritional science postdoc. So that is, after medical training, I did a fellowship in nutritional sciences, geriatrics, and obesity medicine. And that was at WashU. So nice. To sum it up, it's a lot of medical school debt.
Yeah, I'll bet. You know, I'm going to try and change gears here a little, and I hate to do it because I've been scrolling through microfiche since the late 80s, just passionate about all of the research and the science. And you know just such an extraordinary amount about this. A lot of what I've watched you for has really been digging into the mechanisms of action, looking at the research that you've done. You just have a great way of culling through all of the misinformation. Damon, of course, being a PhD and a registered dietitian, I could spend hours just talking to you about all the stuff that you've kind of already covered, which I don't think benefits our viewer necessarily, because what I've found more and more recently as I go and do seminars, I just a couple of weeks ago I was in Cincinnati, and the gym owner said to me, who's a longtime friend of mine, I got done with probably 3 hours of presenting on nutrition. And I talked about a lot of the stuff that I've learned from you over the years and from Damon. And we talked about the epidemiology and IARC and dispelling myths about things like red meat and a whole host of, and I feel like I spend 80 or 90% of my time trying to convince people that this is the right path to take, rather than just introducing to the path. And so my friend said to me, he said, you know, you had them at hello, and the rest of the time I felt like you were watering the lawn with a fire hose. So what I want to try and challenge you today, and what I really try and get through to my audience, because I'm a bit of a meat neck and I feel that I'm more of a bro science guy at heart, is to see how much actual practical takeaway information we can discuss and relieve ourselves of the responsibility of explaining all the misinformation that's been put forth by, all the stuff that you did on Doctors was most of the time just felt like you were trying to dispel bad information and myths. So here's the things I think that you're uniquely qualified, that people will appreciate. You're obviously an expert in all these things, but just recently you have a beautiful baby girl. And I get lots of questions, oddly enough. Over half the people at my seminars are now women, and some of them are older women. And they ask about, whether it be from DM or in DMs or emails or texts, they ask about pregnancy, nursing, and how they should eat for good health, how their infant baby and their children should eat for good health. Let's dive into that.
I'm so thrilled that we are talking about something other than protein. I mean, listen, it is my mission to dispel myths and to bring good understanding to the public. I feel a responsibility to do that. But I also love the opportunity to talk about other things like my practice, my baby, my Navy SEAL husband. There's so many other dimensions to what I can offer your listeners so that they can take it and become better themselves. So I'm really excited to be able to talk about that.
Great.
Yeah, we're excited to have you.
Before and during pregnancy? What was on the top of your mind? What do I need to make sure I have so that my baby's healthy?
In terms of pregnancy, so I had a very interesting pregnancy. I was actually sick for 10 months and my husband was still active duty. I was alone for the first 8 months of my pregnancy and I had that condition where you vomit all the time. So that being said, my perspective was a little bit different. I was unable to consume the things that I would normally consume. Really, any kind of red meat, any kind of protein made me vomit, which was interesting. No idea why that happened. For women who are undergoing pregnancy, I would say that they have to have a good prenatal. You have to have good fish oil. These are things that are hard. It's hard to ingest that much in the diet. And good hydration status. And I still trained throughout my whole pregnancy. So I would say the nutritional aspect, the supplementation, and then the training are 3 essential keys to maintaining a healthy pregnancy.
Yeah, let's touch on the exercise real quick, because I know a lot of people are under the impression that if you get pregnant, you can't go to the gym or you shouldn't lift weights. And so maybe let's touch on that a little bit.
Sure. There's not that much, being kind of a nerd, there's actually not that much data in training in pregnant women. If you were to do a Google Scholar search, there's not that much. That being said, your biggest way to protect yourself against gestational diabetes is maintaining your muscle tissue. For me, I had just transitioned into kettlebells, doing a lot of kettlebell movements, single leg, bilateral movements, single leg movements, bilateral movements, and I just kept training. I mean, obviously your goals are different. I'm no longer training for body composition. That would be a disaster, because I swear you gain weight in the first, before you know you're pregnant, you think to yourself, oh my God, I mean, what happened? Truly. You're super ripped, really fit, and then all of a sudden you don't know you're pregnant and it's just totally blown up.
You're looking at food and all of a sudden your pants are getting tighter and things are happening.
Yeah, that's actually putting it nicely. So thank you.
I think you said something it's critical for everyone to know, and you talk about it a lot in terms of protein consumption, but also the benefit of muscle. You mentioned, you talk about it as an endocrine organ. I hope not to take too deep a dive here, but we've now discovered, after historically not recognizing such, that we thought fat was dormant.
Right.
It was dormant in the body, and then we find out that it does release hormones. And you're mentioning that the enzymatic action or the glucose absorption action is a pretty critical function, like you mentioned, in terms of gestational diabetes. And then last week we had Ben Bickman on, and he talked about the fact that it can reduce insulin increase by up to 50% having active muscle tissue. So were you primarily lifting weights or just exercising?
No. I mean, a core fundamental value of mine in terms of my own fitness is resistance training. And we know that when you are exercising muscle, you have an increase in glucose disposal that doesn't actually even require insulin. So it's a twofold. So muscle allows you to have the capacity for glucose disposal, and then exercising muscle has even a different pathway for glucose disposal. So resistance training was key.
And I think women are under the misguided impression that if they exert themselves, they might cause some harm for the baby, and so they feel as though maybe just walking or doing some light cardio is more important. And in fact, you're stating that it's just the opposite is true.
That is probably a big mistake to do that for women. I mean, we are a big problem of individuals now is they're very domesticated. What I mean by domesticated is, I've been sitting for the last couple hours. I'll use the elevator to go downstairs. We're largely domesticated, and we have more luxuries than we've ever had. When you're training and when you're pregnant, I would say to continue to not domesticate your body is really important for the fetus. My daughter she's a maniac. She was super active in the womb. She's super active. She was able to hold her head up by 4 weeks.
Wow.
Yeah.
She was rolling over by 6 weeks old.
In terms of an intensity, maybe for the audience, for those women listening, what would be, maybe, I know people talk about percentage of 1 rep max, and that's probably not a good indicator here, but maybe like a rep range for exertion. Like, what would you say?
Well, again, I was really sick. Every time I went to train, I would have multiple throw up sessions in between. So it would be 12 reps, throw up, 12 reps, throw up. Can you imagine? God, they were probably so
That's
happy
quite a
after
workout. Yeah.
Right. Now, what's really important that we encourage women to go do the weight training, because not only is it about muscle loss, as you mentioned, was so important for glucose uptake, but also for bone mineral density, and that if they're losing some of that calcium in the bones, that can be detrimental during pregnancy, especially for the back and everything else.
Yeah, you definitely want, for quality bone health, you want to have high quality dietary protein and resistance training. And of course, optimal calcium intake. Those 3 aspects really help bone formation, bone maintenance, and of course your hormones. Estrogen is really important for bones.
Yeah.
And for guys too, by the way. I have a lot of guys that come to me that have been on anastrozole or aromatase inhibitors. I take them off immediately. If you look at the bone density of that's antiquated information. If you look at the bone density of those guys that have been on anastrozole, and you look at them before and after they're put on aromatase inhibitors, it's lower. Guys shouldn't be on that.
Yeah, I agree. And of course, me being from the competitive bodybuilding and powerlifting industry, I see it all the time. And it seems now, even in the HRT clinics, up to today, when a doctor prescribes testosterone, almost concurrently, they prescribe anti-estrogens for that same individual. So I've been speaking out against that for years. I think 8 or so years ago, I started doing videos and telling people that they should be monitoring their testosterone dose in a more responsible way, is to minimize the estrogen conversion, because taking anti-estrogens puts them in a real compromised position.
Absolutely. We know it's good for heart, for bone, for brain. When I was in my fellowship, I did my fellowship in geriatrics, and you look at cognition. One of the things that they wanted to see was that your hormones were optimized. So, and they looked at intranasal sprays. It never panned out, but that's science.
Yeah.
The recommendation that I make, of course, work with your doctor, get your blood test, is to just microdose. Use smaller amounts of testosterone therapy if you're going to do that, with more frequent injections, and then try and wean yourself off, if not completely get off of the anti-estrogens. And then pay attention to your liver health, because that's where the estrogen conversion takes place. And a lot of these guys end up taking medications or drugs that will compromise their liver health, and then that compounds the problem, the estrogen conversion.
Yeah, or they'll overdo it with some of the drugs, and it'll start to affect renal issues, and that can be that's something nobody wants to deal with. So
don't let Stan steer off into a bodybuilding conversation here. It's bound to happen with me.
That was kind of my fault.
No, that's okay. It's really important. I think those are reasonable recommendations. So now your baby's born, and what are you thinking of in terms of? I mean, certainly your nutrition is necessary to provide her the nutrition that she needs through your milk, and then subsequent to that, when she transitions to food, and what kind of food?
Well, first of all, I am still breastfeeding, but she is actually, and I'm really tiny, hard to believe, but I'm only 5'1". I'm a very tiny human, and I am not able to keep up with production for her. She drinks a minimum of 25 ounces of milk. That is a lot, and that would be a full-time job for me. So I've recently started to supplement, and I use goat milk, which is the most similar to breast milk, and I get a formulation from Germany. It's called Holly. I think it's HOLLE, something like that, to supplement breast milk. And I add in DHA, which is important for brain function, and vitamin D. Although I'm taking it, it tends to be low in breast milk.
Right.
And zeaxanthin and lutein, which is really hard to get. The babies don't have it, so you have to supplement.
Say it again in case I glossed over it, because a lot of moms, they end up, maybe they don't have enough milk, and the baby needs additional supplementation on top of the milk that they produce. Can they go to Costco and get a formula, or are there some things to be concerned about there? High fructose corn syrup, soy protein?
Yeah,
Should we,
I mean, I wouldn't.
where should we be?
I wouldn't feed my child that. I think that.
So what would you feed? What should they go get as a
So,
supplement?
well, I mean, like I said, I actually ordered it from Germany, and I use this company called Holly,
Yeah.
and I think it's a great product.
Yeah.
And it's goat milk, so I use goat milk for her.
Okay, gotcha.
And listen, all your women listeners, the ones that are just getting pregnant and having babies, they are not going to want to supplement. They're going to want to do everything to protect the baby. They're not going to want to train hard. They're really not going to want to supplement. Probably not even going to want to give the baby a pacifier. I mean, these are all things that I experience. I'm telling you, all the women I know and all the women in the training space and all the women in our space, really, it's a very underrepresented conversation that we're having right now, which I'm excited that we're able to have it. Just for the women to relax a little bit. The baby, I swear the babies are born with a particular constitution. I mean, like my kid, she's tough.
Right. So they don't want to, they don't want to restrict. When you're pregnant, what you eat is then, for their baby's health and, eventually going to be for your baby's feed and the milk. So what I'm concerned about is that they start demonizing certain foods, and we know what those foods are because the health industry's told us that you have to avoid red meat, and you have to avoid fruit, and you have to avoid dairy, and you have to avoid salt. How important are all of those things to keep including in the diet for a pregnant mother?
It is really important. I mean, that's an absolute no-brainer for me. It is really important. You need to get, typically women put on weight so that you can go a year of breastfeeding. Your body is designed to then put on fat. Not very exciting, but it happens so that you can feed your baby for a year. I mean, the increase in prolactin actually decreases fat utilization.
Yeah.
Right. Well, and the silver lining there is the breastfeeding does increase your daily energy expenditure. So as that year goes on, that will actually help your body lose that weight. So it's a natural occurrence.
Yes. And it's a surprising one. Everyone talks about how you start breastfeeding, you lose weight. I did not find that to be true, actually. No. I actually found it to be the opposite. I'm like, wait, what is this over here? I'm like, what is this, a fat? I never had a fat in my life.
I think
so having a balanced diet, and when I say balanced, protein requirements go up in pregnancy. Yeah. And I was looking at some of the recommendations, and they say it's between, one group says it's between 70 to 100, which I think is much too low. And then there's a gram per kilogram amount that people could just Google. For me, I recommend eating a gram per pound body weight, not per pound lean mass, which is really a lot of the data supports lean mass, but I find that it's very hard for women to get that protein in particular, just in general. Women are not thinking, oh man, I want to have an extra chicken breast. They're thinking, man, I want to have an extra Twinkie or whatever they're eating,
Right,
so.
Right.
Yeah,
That's
we tend to agree
takeaway
with you there. Yeah, and use, full body weight, not lean mass. And one of the reasons that we suggest that is the body composition measurements are just so variable anyway. There's not a whole lot of accuracy on them. So just use the number on the scale and 1 gram per pound.
I agree.
And fortunately, with a lot of the work that you've done and other professionals in the industry, people are starting to get comfortable with that, about a gram per pound. Starting slowly. Of course, some of the opposition.
It's a really slow transition.
It is.
I can't believe the misinformation out in the media. And, I'm not particularly a zealot one way or the other. I just actually see real people. I see patients and I see, I've seen them for years and how they've suffered. And I ran an obesity clinic. I mean, nobody wants to be dealing with this stuff on their own. And it's totally unnecessary. It's very convoluted there.
Well, after you've gotten your gram of protein per pound of body weight, your macronutrient, at least the most important, I think, macronutrient.
Yep.
We start to worry about, what types of proteins do you eat so that you get the micronutrients that you need? I think one of the worst things that happened in the professional dieting industry is what I call bodybuilding, figure, physique, bikini. People I've been working with for 30 years. One of the worst things that's happened is that the general population has started adopting some of their highly restrictive diets because they see these women in what they appears to be the best shape of their lives, getting on stage in bikinis, and they think that that's something that they should replicate. Unfortunately, those women are eating egg whites, white fish, and broccoli, and usually to compensate for all of the deficiencies, or compensating for the muscle loss with Anavar or some steroid. They're compensating for the low thyroid function by taking thyroid. They're increasing their metabolism by taking clenbuterol.
They're amenorrheic.
And then all of the female triad occurs, the anemia, the amenorrhea. The general population doesn't see that. They just see this woman in the best shape of her life, what they presume to be the best shape of her life. And so now you've got some folks that might presume to think that that's a healthy diet. So the proteins that they eat, it's important that they're what kind of proteins, not the egg whites, whitefish, and broccoli, but what kind of proteins do you think are most beneficial?
I think you hit the nail on the head, and especially with your vertical diet, you do a lot of micronutrient-rich foods. Obviously, red meat, liver is a great source. The whole egg with choline, fat-soluble vitamins, really the richer the nutrient source, as long as calories are accounted for, having that high bioavailability of iron, anything red, salmon.
Right. It's so unfortunate that the red meat's been demonized, but it's 3 times the iron of chicken, and it's 6 times the zinc and 9 times the B12, and you get pregnant women that go in and end up coming up with deficiencies in blood tests, and they get shots of iron and B12, and it seems
it's very preventable.
Yeah,
and this is something we've talked about a lot too. With women, they're a smaller human, like yourself, right? You're 5'1", you're caloric.
Smaller.
Right? So, but their energy requirements are going to be less, right? There's a lot of women out there that they're lucky if they need 2,000 calories if they're a smaller stature, and so how are you going to get all the nutrients you need if you're only eating that amount of food? So they need to be very nutrient dense foods.
And that's actually, I totally believe that that's the way of the future, really streamlining what people are eating and coming up with plans that are micronutrient dense. That's definitely the way of the future. So
yeah. And it was interesting, I was at the airport not too long ago, and I'm standing in line to get a water or something, and the guy in front of me had 2 kids. I've got a 5-year-old and a 7-year-old, so I think about this a lot, of course.
Congratulations.
Yes.
I now know what that means when you say that.
Yeah, I'm past the no sleep stage. Yeah, it's a lot of work. But I don't know any way to say it, but the way I feel it. And the guy turned around, he looked at me, and he's like, he said something to his kids about eating broccoli. And this isn't an anti-vegan statement at all. I'm just saying this is for a growing child. He looked at me, and I'm a pretty big guy, and so he's like looking at his kids. He's like, right? Tell them. If they want to get big and strong, they got to eat their vegetables. And I said, actually, they need to eat plenty of steak and eggs if they want to get big and strong. And he looked at me like I was the devil. His eyes got this big. And I'm like, I just got to say the truth. So that kind of transitions us from the pregnant mother to the nursing mother to the infant into adolescence. What do you anticipate the children's protein needs being, and what kinds of proteins do you anticipate feeding them as your daughter grows?
There's definitely, they do have a recommendation. I don't know that number because we know that the RDA is wrong. Yeah. So whatever the number of the RDA is for growing individual, I think that up until 14, and I don't want to misspeak, but I think it's 1.2 to 1.4 grams per kilogram.
Yeah.
I'm not sure. I don't remember, but I would say probably double whatever the RDA is for growing children. Yeah. We could just easily look that up, but I know what my daughter's going to be eating.
Yeah. It was interesting. I was at the NSCA conference last year in DC, and Dr. Jose Antonio got up and presented. He has 2 daughters that were college-age athletes. He's a president of the ISSN.
Yeah, he's great. He does a lot of the protein overfeeding studies.
Yes, exactly.
Yep.
Well, one of the things he said, he did a presentation on feeding adolescents, teenagers. And he said, I know people really, they worry about this a lot. He says, get them a gram of protein per pound of body weight, and you're good. And he didn't take a deep dive into all the other micronutrients and the like. He said they'll probably figure it out within those requirements. He said, and they'll achieve their potential from that. So obviously, you and I like to control a few more variables, but I thought it was kind of relieving as a parent that you don't have to micromanage every bit of that. And if I like them to get a steak and an egg, but if they do a PB&J, and I look at kind of the day's total, and kids will be kids, and we all live in the real world. But if I can manage that part, I think I can do that pretty consistently.
What I really loved about it is he didn't overcomplicate it. Right. A lot of the information out there now, it's this juice cleanse, this crazy diet. It's very complicated, and it doesn't have to be. Good nutrition, having a core foundational plan is not hard.
Yeah.
Right.
The barrier to entry for excellence isn't that hard.
I agree. Let's transition. You get a lot of clients in your practice that come to you, and I've found that as they get older, they tend to have more digestive problems, more hormonal problems. I see this more in the women that come talk to me that are in their 40s and 50s, and I'm sure you do too. IBS problems, maybe Crohn's, autoimmune disorders, maybe some menopause, hormonal deficiencies. I'm lumping a whole lot of stuff into one category here.
Yeah.
I'm saying for that individual, I get a lot of, when I take a break at a seminar, those are the ones that come to me and they've got very specific questions about their current challenges. What do you do when somebody comes to you and they've got, a lot of gas and bloating and IBS problems and their digestion's been bad for a while? Where do you start with those people? What's something they can do right away?
This answer is probably going to be different than another answer if you asked a different physician.
Sure,
Yeah.
it's fine.
My perspective comes from is a multifactorial perspective. So I see SEALs and combat operators that are deployed and are coming back. I see them and I see their wives. And then I see these women like you're talking about. And the symptoms, shockingly, are very similar. So the first thing that I do is I send them to an old school parasitologist, infectious disease guy. Hands down. His name is Kevin Cahill. He's about 900 years old, and he has hair out of every orifice. The guy's eyebrows and ear hair you could probably braid them. I love this guy. He sees diplomats from all over, because the current way that we have to identify pathogens is really poor. When individuals say, "Oh, I gave this 3-day stool sample and it came back negative," and their clinical symptoms don't match up, and that's where the science and the literature and actually being in clinical practice, you have to bridge it. So if a patient has symptoms of strongyloides or whipworm, and they're having itching and rashes, and it's cyclical, and they're eating a lot of sushi, or they've traveled to Mexico, or they went abroad, you got to send them to parasitology. Number one. Number two, then you begin to check off the list. If you screen them, you do a SIBO test. You may do a H. pylori test. I have a very low threshold for a professional evaluation. I think that that's a big mistake that happens in the functional medicine world, is that this person is coming here and they haven't had a proper GI workup. They haven't been imaged. The treatment has to match the severity of symptoms. And that is absolutely, if people take away nothing from this, I'd want them to understand that the treatment has to match the severity of symptoms. So if an individual has been struggling for years, I'm not going to put them on an herbal remedy, right? I'm not going to say, "Wow, you've been struggling for 12 years. Here's your bottle of herbs. See you in 3 months."
Right.
I'm going to say, "Okay, have we identified what's your blood work? What are your inflammatory markers? Tell me your hormones. We're going to look at everything. And you are going to go to a parasitologist. We're going to get a comprehensive view."
Now, I like how you're getting in front of the problem, because oftentimes when people come to me, they start telling me all the stuff they're taking, which is reactionary. They'll tell me
100%.
particularly if they've got menopause. Now they're like, well, they gave me estrogen, and then they gave me antacid medication. And
Right.
then, of course, that usually evolves into antidepressants as a result of
Right.
the antacid medication and the malabsorption of nutrients. So, a matter of fact, I just heard this 2 days ago when I was up in Fort Worth, Indiana. I'm giving you basically the same questions that the client gave me, or the individual that came to my seminar, without disclosing too much information. But that's, it's painful to listen to, because they're in this symptom managing
Yes.
position. And they're
Yes.
on 6 different medications as a
If
result.
it's not better in 8 weeks, it's the wrong diagnosis. It's the wrong treatment. If it is not getting remarkably better, and listen, some things take time to treat, but if it's not better, and you're utilizing, like you said, these external, extrinsic factors, more caffeine, now you're at from 200 milligrams to 800 milligrams, and you keep increasing to make up for the deficits, you're doing the wrong thing. You haven't gotten the diagnosis right.
Yeah, and almost out of the gate, like 2 things happen when people present with digestion problems, almost immediately they get prescribed an antacid, which is a dead end road, and it leads to all of those other. And generally, if they have sleep issues, they get Ambien. So now you've got a lack of REM and stage 4 sleep, and they're exhausted and not recovering. When they start with those two medications, it's just dominoes from there for all the problems that they're going to have ongoing. And so my recommendation is they've got to find out how to get off of those and get in front of the problem, which can be, as you just mentioned, between the parasitology and the SIBO test and H. pylori. It just takes the right kind of practitioner with the kind of understanding that you have. And it's been my experience from 30 years of dealing with general practitioners and even with HRT throughout many of these years, and they would make recommendations, and I would kind of think that doesn't sound right, and so I would go to a specialist, either an endocrinologist or somebody who had much more experience, and get a completely different answer. So I think that our clients have to not outsource their long-term recovery to any. They have to be pretty active in asking questions, getting second opinions, and someone like you is, I think, a great resource for that.
And another aspect of that is when they find someone, really be able to stick to that and execute the plan. There's no benefit. It's like an individual who's going to multiple different trainers, getting multiple different opinions. Oh, well, this day I'm going to do metabolic conditioning, but this day I'm going to do, my heavy load, right? I'm sure you've seen that, especially with your celebrity patients. They have a ton of input, and I think really finding a teammate who you're going to go through it with, and who can quarterback, like a corner man. That's what people need a corner man.
This is kind of how this conversation started, because the reason we spend 80 or 90% of our time dispelling myths and getting people on board and convincing them this is the right pathway, because they need to comply and stick with it and buy into the solution, because they're immediately, as soon as they walk out your door, they're going to get hit with a video or an article, or the guy behind the desk at the gym, or as Damon said earlier, their massage therapist is going to give them some idea, whether it's a celery shake or I don't know why you're doing that, you should do this, watch the Game Changers. And now all of a sudden, you haven't addressed, and they use a few big words, they throw out some mTOR pathways and some AMPKs, and next thing you know, they're like, oh, this guy sounds pretty smart.
Right.
And you didn't spend 90% of your time, explaining this to your client, nor should you. I think it overwhelms them. Again, that's the watering the lawn with a fire hose. So
absolutely,
you do have to get them to buy in at some point, because of what you said.
And luckily for me, I feel fortunate, and you're probably at this stage in your career, the people that are coming to you, like your friend said, you have them at hello. They are there because they want to be a part of what it is that you're offering. And I would say that there's a very low threshold for resistance on my patients. And I'm sure the same with yours.
Yeah. Mm-hmm. Yeah, definitely.
Well, I think the next transition is to geriatrics. You have a specialty there. In the next room, we're out at my house here in Las Vegas. This is where we do this from, my studio, right? In the next room is my 89-year-old father, who's doing quite well.
Congratulations.
Yes, thank you. And 5 years ago, he was on medications. He was on statins, and he was on some other medications. And we've been able to get his blood work righted, dropped a little bit of weight, got him moving around a little more, got him off the red wine. And too
That's
much
really
red
big
wine,
for a
I should probably say. And he's quite healthy, and he is doing very well. What kind of what are the important factors, not just diet, but we talked earlier in terms of muscle retention. What are the most important things that someone can do for their parents now?
That is a bit of a loaded question. So the nutrition part, we know. The most important thing for an individual as they age is for high quality protein, because of that natural process, that decrease in satellite cells, decrease in mitochondrial biogenesis, all the functioning aspects of the muscle, decrease in motor neurons. So maintaining your muscle tissue is primary, and that's through resistance training and exercise. Now, I talk a lot about that when it relates to sarcopenia and sarcopenic obesity. You said something really important, and that is decreasing alcohol. for sure, there is a decrease in cognitive reserve and cognitive capacity as an individual ages. So you need to remove any external insult. Drinking, I pull that off the table. When I was seeing geriatric patients, they shouldn't be drinking. Medications, sleep medications, pain medication, all that stuff should be off the table. Keeping them active in terms of mentally active, being out and learning new things. Those are all key. Lifestyle, you've got to get them sleeping. Any unnecessary surgery, every time you undergo anesthesia, it decreases your cognitive capacity, which is it decreases the capacity of the brain. And we see a sharp decline in memory when that happens.
That's a huge deal because alcohol, again, like Ambien, impairs REM and stage 4 restorative sleep. So while it might help you get to sleep, it's compromising the quality of that sleep. So maybe that's the pathway by which brain function declines, is just the sleep inhibition, the cumulative effect of that. It could be the alcohol itself as well. I'm not trying to demonize things for people.
Yeah.
I have a glass of wine here or there, but generally people think that they drink at night, right before bed. And so it has its most significant effect on sleep at that time.
That, or they'll drink it with a meal and they don't understand that the body's going to prioritize, taking care of that alcohol before digesting the food. So there's a lot of the meal that doesn't get digested because the body's going to prioritize getting rid of that toxin or the alcohol that's in there. And I hate the word toxin in the body, but alcohol is probably one of those things that would actually fall under that category, and it actually gets treated that way. So,
well, and you're recommending protein even more than what you would recommend for, say, a middle-aged person, because they don't absorb it as well.
Right. So they have decreased planktonic extraction. Their ability to actually extract the amino acids and then utilize the amino acids decreases with age. So having a more optimal protein diet is key, for sure. And interestingly, the literature supports having a higher blood glucose. So hemoglobin A1C is higher, and also blood pressure higher to improve cerebral perfusion, blood flow to the brain,
right,
which is very specific for a geriatrician versus a family practice doctor.
Right. No, I've seen some research on that as well. It's important because some people will think if they've got a slightly elevated blood pressure, they need to go in and get on diuretics or something.
Or they've already got them.
You should manage that with a geriatric doctor.
And that's important. It's interesting in our space, it's a younger crowd, but you have baby boomers and an aging population, and I don't know where they go to for information. Those individuals are going to be considered radical to hear this information and implement this information. Not necessarily my information, but the information in this space. And it's important. We have a responsibility to get that correct for them.
Right.
Yeah, definitely.
Yeah, I certainly know there's other ways to get protein, but in terms of micronutrient density, we're still recommending, like my father, I still put red meat in his diet. I still have whole eggs in his diet. He has he can tolerate dairy, so we put some yogurt in his diet. So we're getting those as the primary protein source, and he's getting well over a gram a pound per pound of body weight a day. I would say well over,
aging,
but around that.
That is amazing. He's lucky to have you. Aging individuals, there's some data to support that minced meat improves muscle protein synthesis, and it's probably it's probably based on the ability to absorb it. But minced, as in ground beef,
I don't know if you said that on purpose, because I'm the originator of the Monster Mash, of course. That's so I make.
You know what? I have gotten messages about it. I think that you blend it, and then someone was asking me about blending rice. You're blending rice and meat and stuff together.
I'll make bison burgers on the grill, and then I'll use a little Walmart mashing tool to put a little bit of white rice in there. I'll make a whole egg and put a little bit of spinach and peppers, and I'll mash it all into like a little hearty, and some bone broth. I'll throw a little of that in there. So it's kind of like a hearty minestrone soup. And we started the meal prep company, The Vertical Diet, and that's one of the meals we sell is the Monster Mash. And people always say, well, it's just burger and rice. I'm like, no. It's the Monster Mash. We trademarked that.
I need that.
But that's all it is.
I mean, that sounds pretty high speed, so.
But it was like you said, it helps increase, because of your increased surface area, it increases, improves absorption and digestion of the meat. So we definitely do that.
And one of the other things is the stomach acid decreases as you age. So adding a little digestive enzymes with, say, hydrochloric acid is really helpful. Betaine, HCl can be really helpful. And individuals, if they wanted to do testing, there's something called the Heidelberg test. Actually shows you where the stomach acid is, where the your range is, where you're at, how much you would need. But if you don't want to do that, just take some betaine.
Yeah, I'm so glad you hit on that. That seems to be one of the main reasons. Of course, when people are taking antacids, it's from low acid generally. The majority of reasons for acid reflux is low acid problems, and then eating a high gas food that causes the reflux. So we often recommend that betaine HCl pepsin for those people as a way to improve that problem, and for elderly people who have a decreased stomach acid. Also, the acid is so important for the micronutrient absorption. You get a lot of folks that just aren't absorbing, their women in particular, their iron or their zinc or their magnesium. And that, of course, is one of the reasons why those antacids can potentially lead to other disorders, the depression being one of them that I see linked so closely with digestive disorders.
I mean, it's dangerous, the antacid. While people think they're benign, I had a woman who had a spontaneous hip fracture, and she had been on antacid for years.
Yeah.
And she just the doctor didn't put two and two together that it really does affect nutrient absorption.
Yeah.
And,
how about that?
Sad,
How about that poor girl, the athlete, the distance runner in Oregon that was working with Nike? I don't know if you remember that story, came out in the newspaper recently. She actually filed a lawsuit against Nike. They were, of course, underfeeding her, as they do most of their distance athletes. I used to work with athletes at the University of Oregon, marathon runners and sprinters, and they starve the heck out of them. And we know it's quite common for high school and collegiate women who are in distance sports to suffer from the female triad. And they get amenorrhea and they get anemia. And she had those problems and then started having recurring stress fractures as a result. She just it didn't have the bone density anymore that was supporting that workload. So that's another, just like you explained there, those deficiencies can manifest themselves in things like broken bones. It's pretty severe.
Yeah, and the key, like you said, is to get ahead of it, is to really kind of be aware of your weakness. I'm sure at some point she was aware that she was under eating, and really having acute awareness to the things that you're predisposed to and when I mean predisposed, I mean behaviors. I don't mean illnesses. I mean knowing that, say, you're predisposed to overconsume caffeine, like my husband, or predisposed to, yes, I'm totally putting him under the bus, so when he hears this, he'll be drinking his coffee and put it down. But we all have behaviors that we're predisposed to do, and staying ahead of those really can allow for a more optimal outcome, because we can change the trajectory of how we age.
Right,
We just
and
haven't
especially
seen people that are doing it. Right,
for the bone mineral. Yeah, for the bone mineral density, for a lot of people out there, if you don't have access to a DEXA machine, which is what it would be pretty much the gold standard for measuring that, just in general terms, most people you're accumulating bone mineral density up until about the age of 30. And then you've got what you're going to have. And then it's this battle of trying to keep what you've got for the rest of your life. So the unfortunate thing is that for like these distant athletes, during that time in their life when it's the most optimal for them to be taking it in, they're probably not getting enough. And so that's kind of putting them behind the curve. And women are at a greater risk long term because of the loss of estrogen through menopause and things like that. So I guess getting to a question here, but so what would you recommend in terms of, like, at what age would you say you would recommend them getting a DEXA scan, and how often would you want them to get it?
So that is a good question. It depends on there are, I'm sure the endocrine societies have recommendations. I can tell you what I do and what I recommend. And that is if a woman has gone through a period in her life where she's not where she is amenorrheic, I will get a baseline bone density scan, even if she's 35 or younger. You definitely want to see where she's at. And then in terms of recommendations, primary care doctors will do a regular DEXA scan once a woman hits a certain age. I don't know. I don't remember if it's 60 or what, but for me, for me to do it earlier will be based on symptoms. So I would definitely monitor that.
Cool. And we should probably mention too, with those who aren't familiar with the scan, you can do a total body scan and you can segment the body as well. And so I've done hundreds of these scans with the athletes on campus here too. We did it as a preventative. And there are times, if you're going to get one, I would recommend getting all of the segments if you can, or have the order written for all the segments that you can, because if you do a total body, that is then going to assess your total body, and it could mask some low bone mineral density in a localized place.
Yes.
So,
right. So it depends if it's a hip or spine. So that's actually really good advice. Yeah.
You mentioned the importance of protein for maintaining lean muscle mass, and then also we talked about getting some resistance training for that benefit as well. Equally as important for bone mineral density to have some sort of loading, and usually people shy away from that. And I just got a text this morning asking if it was okay for a 70-year-old to lift weights. And my response was absolutely. Look at the folks from Barbell Medicine. They're prescribing this to people as part of longevity, not just lifespan, but health span. So someone over 70, we'd still want to have them do some exercises that would require some sort of, when I say axial loading, I mean either a squat or a deadlift or a weighted carry or even like a partial rack deadlift. I have a little thing in the gym here, and my dad will go out and grab the bar, and he only moves it 6 inches, and holds it there for a little while. And that loading, it's so important to have the right stimulus in order to utilize those nutrients well. Are you recommending your elderly patients do that as well?
I mean, I'm not doing a ton of geriatrics now, but absolutely. I mean, my dad is 70 and he's a beast. Yeah. I mean, he walks, if he has to take transportation, if it's a 3-hour walk or less, he'll do it himself.
Wow.
If it's over 3 hours, he'll take transportation.
Wow. Yeah, that's incredibly beneficial for elderly people to lift, because I think I heard you recently talk about, or maybe it was Dr. Hyman's interview, where we talked about the fact that longevity can be measured by strength.
Right. Yeah. And if you think about it, if an individual gets injured, their amino acid reserve, their muscle tissue is what's going to save their life. Nothing else. It is their capacity for their body to recover. Even cancer, cachexia is what, there's different things that kill people from cancer, but cachexia is certainly one of them.
And do you find in the geriatric community that a lot of those folks are there just because they're frail, not necessarily because of some other problem? Yep.
Frailty is an illness.
And if they fall and get injured as a result of the weakened bones or the weakened muscles, they're much more likely not to recover from that kind of thing.
Absolutely. And with the decline in muscle tissue, there's all kind of metabolic dysfunction that happens. Their ability to utilize glucose, their ability to utilize fatty acids. I mean, that tissue is their metabolic currency, which then decreases. And we know that glucose is toxic. Glucose is toxic. I mean, obviously, you can have a certain amount, your body can dispose of it. So excess glucose is toxic to the cell.
Yeah. Well, and with your diet recommendations being at 1 gram per pound of body weight.
Yep.
And then, of course, understanding that you should get an adequate amount of fats in just for general health. Mm-hmm. It doesn't leave a whole lot of room for sugars anyhow in a responsible diet. You'd have to eat much less protein to get much more carbs. So you've kind of already created the macro percentage that's optimal for most people. Spread those throughout the day, exercise regularly, work your muscles, and I think you're managing that blood glucose pretty well.
Yeah. Yes, absolutely. And for my patients, I don't recommend more than 40 grams per meal. Of course, it depends on if it's a guy like you or maybe his training, but for the average person, they don't need more than 40 grams of carbohydrates per meal, 30 to 40 grams.
You've said many times they have to earn their carbs. If they have a high workload, then they might have to fuel that particular workload. But otherwise, they're relatively they're completely unnecessary as far as requirements go.
And I love how you said that there's a responsible feeding pattern. There's a way in which you can responsibly eat, because I think people don't quite understand. When I was at WashU, we would image people's brains. And when you saw midlife obesity and you saw the damage in the tissue, there's flattening of sulci and you just think they don't really have a concept of what is to come. And we know that the wider the waistline, lower the brain volume. And that is literally by dietary choice.
No, 100%
Definitely.
agree. One of the things that becomes difficult, most diets work when they're strictly adhered to, but a lot of people regain the weight. I think that we set people up for failure. We give them too restrictive of a diet plan. They get hungry and get tired. Or we implement probably too aggressive of an exercise program, and they just simply can't comply or get tired and hungry as a result of the exercise. So do you have kind of a minimum, something that people can do regularly and consistently and compliantly over time in terms of what their exercise should look like?
Well, you're talking about the recidivism rate, the rate of relapse. And, when I think about that, I really think that the mind is their primary organ at that moment. Their mind is primary. And if you don't address their mind frame, they will be constantly chasing habits to become a different individual, and they will never succeed. If you can get your individuals or patients, clients to deeply become a quote different person, then the habits become easy. For example, I'm not the kind of person that's going to eat cake. If I'm at a party and someone offers me cake, I don't say, oh no, I'm on a diet. I just am inherently not the kind of person that is going to reach for that. So, and I know that your question was on exercise, and I would really say, that really depends on the training status, and talk to a professional who prescribes it. I mean, there is, individuals really go through, for excellence. Like, I don't program any of my own stuff, so I don't recommend specific plans. I say, reach out to the experts who do only that all the time. But that being said, it's for them, in terms of success, it is all mind frame driven.
When you have a client that you give them a program, whether it be a nutrition program or a supplement program or what have you, what do you look at most in terms of compliance? How do you design it such that they can stay on the program? How do you monitor it long term?
It has to be easy to understand and easy to follow. I am not someone who's going to say, here's 50 supplements, go do this. My philosophy is, here's a foundational plan, figure out your protein, balance the rest of the carbohydrates, get your healthy fats, really have an understanding of how you're going to do it, what's your eating strategy. It's easy and you can accomplish it. And then in terms of supplementation, it's the minimal effective dose. How much, the least amount that you can take is, what I'm going to recommend. And we go through cycles, right?
Can you repeat that again for our audience?
Minimum effective dose.
Yeah.
The minimal effective dose. It is not taking 500 supplements, and I have access to everything. It is not effective. It is not responsible. There are different seasons of life. You need different things during those seasons. But the goal, I don't keep people on supplement protocols indefinitely. I love to cycle them off. There's a consequence for everything you do, even if it's healthy. For example, if you are taking a lot of a particular vitamin, you may downregulate your ability to utilize it. So there are consequences. For example, caffeine. If you're going to be drinking a ton of caffeine, your body will downregulate the capacity to utilize it. I think having an awareness and taking a step back of this, the multitude of information that's out there, and really thinking, okay, what can I do long term? There is a certain amount of sacrifice that is necessary for excellence. All of us here can probably agree to that. And then once you determine what that is, where are you going to be on that spectrum? What are you willing to do? And then that becomes your new norm.
Oh, I think that's excellent.
And it probably changes over time too, because your goals may change over time and your needs are going to change over time. So it's something that needs to be revisited, but it's not something that probably needs to be revisited every day.
Right.
Because we see that too. People are like, well, we're in this time of instant gratification where, you want it to happen right now. And so tomorrow you didn't lose the 15 pounds that you wanted to. And so, oh my God, I got to change up my program. And it's probably at least a weekly or like every 2 weeks would probably be a revisit to, you got to let things work.
Totally.
So
I see
And the
that
one
people,
question, yeah, and the one question that I always ask is, did you execute the plan? It's yes or no,
consistently,
right?
right? Consistently
right,
for that
Right.
whole period.
and all
Oh,
of it.
and as soon as they start with, oh, well, no. It's yes or no. You either did it or you didn't.
And it's comprehensive. You have to do everything. If you can't, like I've always said, you can't take your 5 grams of creatine and only sleep 5 hours a night.
Right.
It's completely worthless. So I have a friend that owns a number of HRT clinics, and I always asked him, I said, is that a good business? He says, the retention's not very good. He says, after 4 months or so, people kind of drop off. And I said, well, why is that? And he says, well, the first month they come in and they get their testosterone dose, but they also improve their sleep, they change their diet, they implement an exercise program, and that first 30 days is euphoric. The changes are miraculous. He says, then they stop going to the gym, they start going back to their old eating habits, and next thing you know, they're in there saying, hey, this testosterone's not working. And
Right.
really, it was them that stopped working, not the
That's
testosterone.
an
Was
excellent point.
it was just an adjunct, And what I find is also that people stop doing what they're what I think they're responsible for. The sleep, obviously, which is 99% personal responsibility, just turning off your phone and getting to bed on time and allowing yourself a full
Unless you
night.
have a new baby.
Yes. Oh my goodness. And I do get questions about that a lot.
Gosh.
And I lived it. I understand it. Fortunately, because I was able to split time with my wife, so she would spend one night with the baby and I would spend the next. And I do have some clients who are competing who are in the financial position that maybe one night a week or 2 nights a week they can bring in a night nanny, so they could at least string together 3 good nights of sleep throughout the week. And I often recommend that they try and employ whatever methods possible to manage that. Because I get a lot of questions from new mothers about that. Well, I have a 1-year-old, 2-year-old, 3-year-old. I mean, and it also kind of depends on how long the mother or the father allow the child to sleep in your bed. Because even if the child squawks in the middle of the night or kicks you in the head, you're coming out of REM sleep. And although you were in bed for 8 hours, you didn't get 8 hours of sleep. So.
Yep.
And it's hard just to say, tough it out. You've got a 2-year-old, but part of it is that. But then just trying to do the best you can with the resources that you have. Again, we split time, and that helped. And some other people may do a night nanny, like one night a week or whatever's within their budget. It's really important. I see mothers really declining throughout those times, and I'm cautious to recommend some sort of help or intervention, so they can be strong and efficient for themselves.
It's tough, I mean, I can speak for myself. My baby's 5 months. I'm not sleeping through the night, and
No, of course not.
right, and I feel a responsibility. So my husband just got out of the SEAL teams in July after 10 years, and he's in his second career now in medical school. I already did it, so I understand. I really don't want his experience to be compromised. He needs to be able to think. And otherwise he'll fail out. He's a smart guy, but still, he's at Rutgers. It's pretty rigorous. So for me, I'm taking the night shifts. I'm taking the shifts, and man, I'm more inclined to do it myself than have someone else there. And even the nights that she sleeps through, this is interesting, I'm very hypervigilant. So I'm still checking on her. I've gotten into this pattern. It's really interesting that whether she sleeps or not, I'm still checking on her 4 or 5 times a night. That's outrageous.
Yeah. My little one had the flu last night, 104-degree temperature. I was on an airplane coming back from Indianapolis, landed like 11 p.m., and we were at the hospital at midnight and at the 24-hour pharmacy getting our Tamiflu at 1 a.m. And so we live it and we understand it. And I guess at the end of the day, I don't have an answer for that. And I did a video many years ago when people asked me about, how'd you compete at the level you did and do the things that you did. And so the video was called "Why I'm a Hypocrite," and it was the fact that I didn't have kids when I competed, and so it was an incredibly selfish endeavor, and so I'm very sensitive when somebody comes to me and says, well, I'm a nurse, I work 24-hour shifts, so I can't, tell them to sleep 8 hours a night. That's not an answer for them. And so we have to just try and manage everything else around it as much as possible, and I think just understand that those are definite hurdles for some people, and You're going to have to do everything you can, and there's a time frame there for you. It's going to be a few more years yet before you see consistent sleep. And those are sacrifices you make as a mother for the rewards that you get. But
and I'm willing to do it. It's all about how you interpret the experience.
Yeah,
there's Viktor Frankl's Man's Search for Meaning, right? It's all about the interpretation of the external experience, how you respond. There's that pause. So bring it, baby. I'm ready for number 2.
I love that you said that. That's a great attitude. And as long as you're getting your regular exercise and you're eating healthy and you're going to lose some sleep, that's given. But if you can control all the other variables as best you can, then I think you've got a fighting chance and you've got a strong attitude for it. And you're helping a lot of other people along the way with all of your great information that you're putting out there. So I really appreciate you having on, and I thank you for taking so much time with us today.
Yeah,
Damon,
thank you so much.
Say in closing, I want Gabrielle to have a chance to tell us where people can find her and what kind of projects you're working on that they should follow.
Oh, my pleasure. I'm most active on Instagram, and that's Dr. Gabrielle Lyon. I have a weekly newsletter so if people go to my website, which needs a total rebrand, they can sign up for my newsletter, and I include where I'm speaking. I'll include what podcasts or shows I've done, interesting people that I've seen in my clinic without obviously saying who they are, what I'm reading. And it's short, sweet, won't waste your time. And it's valuable. I try to make it very valuable. I am working on a book, and that is a process.
It is.
The goal will be to be out in a year, but it probably won't. Probably be more like 2 years. We'll see. I'm going to work on that. And that's really it. And for anything up to date, they can find me at, Instagram, website, Facebook, same name.
Awesome.
Awesome.
Well, thanks, Gabrielle. It's really a pleasure talking to you. I'm glad I feel like I know you already. I've been watching your videos for years, and all your Instagram posts and your family, beautiful family, and I'm just excited for everything you're doing for people. We really appreciate you having you on.
Wish your husband luck on med school.
Yes, that's right. That's right. Yeah, he needs it.
Thank you, Gabrielle.
Yeah, thank
Good
you.
talking to you.
Yeah, thanks for having me.
Take care.
Hey guys, Stan Efferding here, founder of The Vertical Diet. We provide a simple, sensible, and sustainable solution to help you reach your health and fitness goals. First, get started with our easy-to-follow Vertical Diet ebook, which includes a quick start guide and sample menus to customize a diet plan that fits your goals. Second, use the My Vertical Tracker app to help you monitor and maintain your progress. And third, for our busy clients who are always on the go, let us do the cooking for you. Our Vertical Diet Meal Prep Company offers free shipping for your favorite meals delivered to your door in the US and Canada. So head on over to stanefferding.com and get started today.